Hi, my name is Jennifer Monahan with Health One Technologies, and I'm here today to demonstrate a form developed by our organization to assist practices with the implementation of ICD-10 using the GE, Centricity, EMR, and CPS products. This form was developed to assist practices with both the reconciliation process and also the search mechanism of finding the correct ICD-10 code for their patient. It is currently being utilized by several orthopedic practices, several pediatric groups, as well as a few large multi-specialty organizations. Today I'm going to demonstrate the form in a standalone update in the GE Centricity application, but the general workflow would be that this form would be part of the office visit, usually somewhere prior to the assessment and plan. However, depending on your organization's workflow, some organizations have actually decided to make this a process that happens at the beginning of the visit, and perhaps your nurses or MAs are doing a reconciliation process prior to the patient being seen by the provider. So there are several different workflows that can be accommodated with the form. Ideally, it would be part of your visit, so you would see it somewhere within the encounter itself. The top part of the form, as you can see, shows you the active patients problem list with the ICD-9 and ICD-10 codes. The system will allow you from here to do a reconciliation process. So for instance, if my patient no longer has bursitis of the shoulder and I just want to remove that, I can click on it, choose reason for removal, and remove that from the active list. And that will take care of that removal from the system without needing to go to the standard problems window within Centricity. The second portion allows us to take a diagnosis and actually define it a little bit more. So if elbow pain, for instance, is something that needs to be more specific because it doesn't have laterality attached to it, I can select the elbow pain and click Change Selected Diagnosis or Problem. That will then pop that down into my search window. So this problem search window is used both from the reconciliation process, and also this is how you're going to search for problems on a routine basis. I'm going to quickly just show you how to search for the elbow pain, and then I will come back and explain this mechanism of search. So the elbow pain from here popped into my search window. I'm going to click search. I'm going to get a list of elbow pains that are available for me in ICD-10 format. So I have pain in right, pain in left elbow, which are more specific than the just elbow pain code. So I'm going to say that this patient has pain in the right elbow. Then I'm going to come down here, identify any information that I might need to. If the onset date needed to be changed, for instance, I could go correct that, make it a different date, any duration that needs to occur. And then I click Change Diagnoses. And that's going to take my elbow pain that was up here as a more generic code and make it a defined pain in right elbow. The one thing that this does, however, you'll notice that I have an ICD-10 code that is more specific. However, I now have no ICD-9 code attached to that. And I will get a little red warning that says this is a missing or a non-mapped ICD-9 code. This will become less important after October 1st unless you have a workman's comp or MVA, that sort of thing. But pain in right elbow does not have a specific ICD-9 code that goes to it in the Centricity program. So that may potentially be an issue for some organizations that need to bill ICD-9 codes. And that would only be an issue for those little organizations that I mentioned, like MVAs and workman's comp. Other than that, the biller should be able to go find an ICD-9 code and apply it for the billing process. So ideally, the best case workflow is that somebody goes through the patient's problem list and actually reviews all the codes prior to October 1st, 2015 to make sure that we have specific enough codes to meet your billing requirements. If you are unsure of what is occurring once you're making these changes, if you click on the Edit Problems button, it'll actually show you that this was removed, that this elbow pain was changed from this to this. So this always gives you a way to double check all the changes that you made at this point. So let's talk a little bit more about the problem search feature and how it works. We have a couple of different ways to search for problems. One is you may continue to keep your existing custom list. I'm going to remove this elbow pane so that we have a blank slate to look at. So from the custom list, if in your system you have current custom lists set up that you are using within the organization, we can build those into this search form so that you have them available to you. The custom list, just as a reminder, do not automatically update with the most specific ICD-10 codes. So there is a process that should occur for organizations to update their custom list just to be sure that you have the correct codes on the list. Otherwise, it will display your current ICD-9 problem list, which may not be accurate enough for you. So when I click on custom list, I have a drop down available to me of the common custom list that I use in my organization. Once I have one selected, they will be listed here in a checkbox format on the right hand side of the page. From here, I can go through this list. I can scroll through, pick codes or several codes that I might actually need. That's a nice thing about this. I can actually choose more than one diagnosis. Once I've done that, I can click Add Diagnosis, and that's going to add those to my patient's problem list in their ICD-10 format. Again, I would have whatever custom lists are in my organization. If I'm an orthopedic group, for instance, and I have custom lists by body part, so I could have a shoulder custom list, a knee custom list, back custom list. I could have all of those as drop-down options. So the custom list displaying over here could be a shorter list for you. In large multi-specialty groups, you may have something like this, where I have family practice, endo, gastro, internal medicine. That may vary just on the organization that you are using this form for. So outside of custom list, I have a couple of ways. So first, I can scroll through the list here. I can also search on my custom list. So for instance, if I'm looking for abdominal pain, I can hit search, and that's going to give me all of the abdominal pains that are on my custom list for family practice. Once I have all of those abdominal pains listed, I could just select the correct one that I want, add in a duration, if I want it only on my active list for 90 days, for instance, and then add the diagnosis, and that will put that in for me. The other thing that I can do if things are not on my custom list is I can come over to the reference list. The reference list is going to allow me to search basically the ICD10 database. Our form uses an ICD10 database that sits outside of the GE Centricity application. This database is downloaded from CMS and contains all of the ICD10 codes that are eligible for billing purposes. It does not include the headers that are part of the ICD-10 process, but only those that are available for billing purposes. One of the things I can do here is I can search the entire reference list, or there are also sets of keywords that are available based on the specialty. So for instance, if my search specialty is set to default to cardiology, I'm going to have a different list that I am going to have if my practice is gastroenterology, for instance. So those specialties actually are set up in your system. They're a process whenever we do the installation to determine if you have multi-specialties or a single specialty and what your keywords will be. I'm going to use orthopedics as my specialty search just to show you a few examples of filters that can also come into play. So with the keyword search, we have gone through a process where we've identified the top 100 plus keywords that orthopedic folks might search for, orthopedic providers. So those would be listed in this drop-down list, and those are just defined to help providers learn the ICD-10 process a little bit so that we know things that are left, right, things that need a code for initial visit, subsequent visit. That's how the keywords are set up along with the filters that I'm going to talk about. So for instance, if I click that I need a acromial process left fracture, and then I click the search button, it's going to return for me the codes that are associated with these words. From here, I may also choose to use my filters and actually drill down a little bit further. The keywords in this instance are pretty specific, so it's kind of only giving me a shorter list that I could go through. However, if I did want to say this is an initial visit, and perhaps it is a non-displaced fracture, for instance, when I put those filters in place, I can search again, and it's going to take that list and define it even further down to the codes that are specific for this particular diagnosis that I'm choosing. So I have a acromial process left, and then I narrowed it down to initial and displaced, and it gives me just 2 codes to choose from. So the filtering process can assist providers in sort of learning how the ICD-10 verbiage is going to work to find the correct code. The other thing that providers can do is if they choose that they not to use the filters on the left, they could always just type those in the keywords. So I could do initial non-displaced, for instance, in the search window itself. And then when I click the search window, it's going to only define those codes that meet that information. So it depends on how organizations are comfortable with searching. If we're still in a learning process of ICD-10 and we want the filters to sort of guide us and say we need to know location and visit and laterality, then you can certainly use the filters. If somebody has had more exposure to ICD-10, they don't necessarily want to do the extra clicks associated with the filters, they can type that into the search window to get the list. One thing you'll notice over here on the far right corner is we do have a checkbox that says include unspecified diagnoses. So by default, when we set up your system, we will ask you, do you want to have specified, or do you want to have unspecified diagnoses included in your search list or not? So if you do not want to, this checkbox will not be checked, which means if I search for things like the elbow pain that we did earlier, if I have this unchecked and I am typing in elbow pain, I am only going to get those things that have more specific codes. However, if I check the box that says include unspecified diagnoses, it's then going to give me a third option that says pain in the unspecified elbow. So the organization can decide whether or not this checkbox is available, whether it's checked or unchecked, and that will sort of guide people to choose a more specific code when necessary. There's also another box here that says enable filters. Just as I mentioned, some groups that become more comfortable with it, they just want the extra real estate on the screen. So they may say, we're not going to use filters, and they can opt to check this box, and it'll just slide the filters out of the way, and they'll be able to see more information on the screen. Okay, just a few more things. On the far right of this form, you're going to notice a banner that we have available. There are a series of buttons, 6 buttons that you can program in your organization to go to whichever forms or websites that you want to. For instance, we have included some in our demonstration that take us to a website for ICD-10 training. So when users click this button, it'll actually launch you over to a website to do some training. You may opt to include your visits in here. Perhaps you want to go to your assessment plan page, or you want to go to your HPI page, a billing page, an orders page, whatever it is. These buttons can be customized to your organization to do whatever you need them to do. There's also some patient demographic information. You get the patient's name, their insurance, their gender, their birth date, height, weight, blood pressure. This is a little bit of meaningful use information that's in the system. Smoking status, pharmacies, just things that are useful to providers. We try to keep this on all of our forms just so it's a standard place for people to look for information. So that pretty much includes the demonstration for today. If you have any questions, you want further information, you want an on-site demo or an online demo, please feel free to contact us at info@h1tech.com, and we can set up some additional time to talk to you as an organization. We hope this information will help you transition to ICD-10 on October 1st. Good luck, and we will talk to you soon.